Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Telemedicine, I'm going to say, we'll start off, I'm going to say...
Good morning. I'm going to say good morning.
We're so busy here. We're just having so much fun. The difference is that we really do have an extraordinary show this morning because, Dr. Mencia, I have always wondered what telemedicine is. I've heard it coming on all the time.
Nothing to do with the telephone.
Oh, darn it. How about sex?
Nothing to do with...
okay.
Well, I don't know about that.
That's right. You can have right.
Because it's anything that have to do with medicine. So if it have to do with medicine, it have to do with the human body and the human being. So I'm not going to rule out sex.
Okay. But let's talk about
our guest.
Yeah. Well, let's talk about telemedicine. What does that actually mean?
Well, that's why I brought Dr. Michael Shen, who has a few patents of his own. And he's a very interesting physician.
But he's a famous cardiologist.
He's a famous cardiologist, had been in renowned hospitals. And like many of us, we have our dreams, our objective in life. And when you get a person like this, I always get young people that come to me and they say, I don't know what to do in my future. And I tell them, let's look at your past. Let's see what you have done in the past, because that's what you do as a chef. If you're going to cook, you want to say, let me see what ingredients I have so I know what I'm going to cook.
What my mother did.
There you go. There you go. Yeah.
Okay.
So when, Dr. Chen, with his background in technology, and then as a physician, eventually putting all this together, it had been a wonderful leap into the future of medicine.
So is the future of medicine on the cloud, as we say, in the internet?
Yes, absolutely. Why
is that?
Well, we are still in diapers, to be honest. We're still in diapers because we still practicing medicine the old-fashioned way. Human beings, they are one of the difficult things is that we don't move to change. We like to stay put. And we have to be willing to change as a society in order for us to grow, in order for us as Americans to keep leading in the world. We have to be the first one to be willing to make changes. And as we make changes, we're going to make mistakes. But that's part of living. Making mistakes and learning from our mistakes.
So what are what is the progress in telemedicine that people can actually be at home and you can diagnose them at home?
Absolutely. Well, imagine we do home visits. So when a patient calls us and say, I'm having chest pain, if we are not there right away, the rule of thumb is, if you're having chest pain and I cannot really go through a differential diagnosis, call 911 and go, call any doctor's office. They tell you, the first thing they tell you, thank you for calling AGI. If this is a medical emergency, hang up and call 911. That's the first thing. So your patient, they are not doctors. And they're going to say, well, I think it's an emergency, so they're going to hang up, call 911. Well, imagine the amount of money that we waste every time we do that. I remember one patient one time called 911 because she couldn't tie her bra. And, it was an old lady in her 90s. She couldn't tie her bra. She called 911. And to her, at her age, she felt this is an emergency. It is not an emergency. You don't call the ambulance and the fire department, mobilize all these people for something like that. And that's a true story. I lived that. I saw that happen. So a lot of people misutilize the emergency system, and we need it for the people out there that truly need it. Now, Dr. Michael Chen, an excellent cardiologist, it will be hard for somebody like him or somebody like me as a geriatrician to be all over. But through telemedicine, we can be in many places instantly.
So maybe now that's our big thing to introduce you.
Yes.
So Dr. Chen, is it Shen?
Shen.
Shen, Shen. Where did you? I mean, when you came in, the first thing he did is he put some things on my fingers. And tell us what you did to me when you came in.
Okay, well, first of all, thank you, Dr. Mencia, Anita, invited me to come here to join this very fun crew. So basically, we have work with other technology companies in hardware. We develop software platforms, and we connect the devices with the patient through these technologies and to their physician. So this way, just like Dr. Mencia mentioned, and we can make diagnosis and treatment remotely in the emergency situation, as well as chronic disease management. And so what we had, this kit, is we have a device. We can measure all the vital signs as in the hospital or physician office, and such as blood pressure, pulse ox, oxygenation levels, heart rate, temperature, glucose levels or sugar levels. And so this information, the unique is to send it out to the cloud. So remotely, your doctor can access it. And so this way you don't have to drive in the case of emergencies, and you have chest pains, you can do this. As well as we have another set of device, we can do the 12-lead diagnostic EKG. It's like a hospital level, hospital grade of EKGs for diagnosis of chest pain.
So, Dr. Mencia, would someone have that at home? If you know that they're a patient that you have to watch, they would have the kit at home, and they would then
They can have the kit at home.
put their finger in here.
They put their finger.
there.
They can put the belt around their chest, and that will do the electrocardiogram. It will do it as many times as you want it. Get a check. Like some people now, they rent or buy the pulse oximeter, so they can check their oxygen level. If you are concerned, you have a strong family history of heart disease, and you cannot see your doctor every day or your cardiologist. Much less your cardiologist. You call your cardiologist for an appointment, it's going to be 6 months. So with this device, you are able to monitor yourself and look at yourself. And then this information is not that you're going to analyze it as a patient, but it goes into the cloud. So you can always call your doctor, and your doctor can look at this. But the use go beyond that. The use in the future is in prevention, the money that the insurance company can save on this. So you imagine a company like mine, AGI, we have around 40 employees, and we offer healthcare insurance to the employees. Let's say 30 of them acquire healthcare every year. Maybe 5 of them go to see a doctor. 25 of them will never go and see a doctor. But with something like this, that it will go through either the company or the insurance company. The business can get something like this for, let's say an IBM, one of those big companies. All of you that have and don't have insurance, you can have this test done on you, and have the cardiologist analyze it or the primary care doctor analyze it from the cloud without leaving work. Can you imagine the amount of money you are saving? Because every time one of your employees have to go and see the primary care for a routine checkup, this is time off from work. This, you can stay at your job, you can get this thing done. So the benefit of this is incredible. It's like an octopus. It's just going to propagate in so many different ways. So it's excellent for a patient that want to stay at home, that live at home, but it's excellent for society to do a lot of the screening, because a person put on the monitor, remember that electrocardiogram that you are doing on yourself is the same type of electrocardiogram Dr. Shen mentioned, like the level of a hospital. When you go to a cardiologist, that's what they do. The 12-lead EKG, the same 12-lead EKG.
I am really impressed, Dr. Shen. I mean, here you are and I asked him, how did you have time to invent these wonderful gadgets, I'll call them, telemedicine, And what did you tell me? That's really what you loved, even though you went to medical school and you went to the very best medical schools and it's been working in a lot of good hospitals. Inside, this was your little dream, wasn't it?
Yes, actually, before I went back to Yale for my clinical training, I used to work with a company manufacturing devices. So they sent me all over the place from East Coast, West Coast, and talk to the physicians and technology, companies. So this way we try to find out ways to improve technology to detect disease earlier. And they find out that they're very interesting and very innovative. But then after I finished my training and start working, and then now telemedicine start on horizon, I see the opportunity to join both technology and patient care together and provide more availabilities and the quality of care for the
So
patient.
how long did something like that take to actually, from the time that you invented to put it on paper, you're thinking about it, and your poor wife and children, if you have any, or they're put it behind the scene, and you've been working on it. How long did it come to see this beautiful little kit now?
Yeah, it takes many years, and actually, the technology going through many innovations of the stages, and the longest time probably not on the device, because the device is, there are many companies doing that. We don't do the specific device. We connect the device to a data platform. So we work with the companies and find out from our patient perspective what patient need. So let's say a patient have high blood pressure, need to monitor blood pressure closely and on daily basis. So we look at the market and find out which device are really suitable. One, they need to be durable. Initially, when we work on a device, they looks very cute, but elderly people, they drop on the ground, it's gone.
Yeah.
And then we need a redundancy as well. So meaning if there's a connection between the cell phones and device that got lost, all these areas, the signal is not very strong, and we need something they can read this, they can talk to the physician. So there are many areas, but the most time we spend is to develop this platform to extract data, collect data from a variety of devices, and connect between physicians and the patient, and try to analyze data and find out where we can improve, where we can prevent problems.
Amazing, Dr.
Amazing,
Mencia,
amazing
isn't
it is.
You're
it
so
is.
excited
It is.
about
Yes,
having this
yes.
in your. Will you have this in your office now?
Well, we're gonna work with Dr. Shen. We want to, it fit right in with what we're doing, because we do home visits. We go to a lot of retirement communities, so it will fit right in with what we are doing.
So home health agencies, would that benefit them?
Absolutely, absolutely, because they will go take the data, go send it to the cloud, and instead of texting the doctor or calling the office, the information is there. They can just somebody at the doctor's office can access the information that is being taken by a nurse. So the nurses, they can rent the equipment and take the equipment with them when they go and see patient.
Well, let me tell everybody, of course, you've tuned in, you've been listening all morning, and this is the special show. This is the Wonderful World of Wellness with Dr. Andy Mencia, and of course he brings guests, but this morning he has brought Dr. Michael Shen, who is talking all about telemedicine and his inventions. He's a cardiologist, but I want to go back to Dr. Mencia. For those of you who would like to come to a Saturday morning review of your body and what your problems are, you want to go there. AGI Medical and Dental Centers in Fort Lauderdale at 1608 East Commercial Boulevard. Phone number to call, 954-489-1345. 954-489-1345. And go on their website, which is agifl.com. Remember, this is Pencil Talk Radio. You're going to give you a lot of information. Write it down. Also, they have another office in Boynton Beach on Hagen Ranch Road, and that number is 561-270-6494. Dr. Mencia, this Saturday morning, the Saturday days that you are there with all the patients, why don't they come on the weekdays? Why do they wait for Saturday?
Well, when I saw Saturday as a geriatrician, I'm always thinking of the biopsychosocial component of medicine. It's not only the biological part, but the social part, the economical part. So when a patient come in and the kids have to come, the son and the daughter-in-law, or 2 or 3 kids, the grandkids have to come in. They are taking time either from school or from work to bring grandpa or grandma to the office to see the geriatrician. So I felt, well, if I do Saturday, most people work except me, Monday through Friday, and Saturday they are off. So it become a nice family affair. People come with their loved one, and they get seen. It's a regular office visit like we do on weekdays. And then I started pushing my dermatologist to come in. My podiatry comes in on Saturday. Dental office is now open on Saturday. So it becomes Saturday for people that are working, that don't want to take time off to go and see a doctor. They can come on Saturday and do that. And people that need to come with their family, either for dental care or for medical care. Now they can come with their family, and if their family, the kids have questions about their care, Saturday become very, very productive. Even our home visit is open on Saturday, because sometimes when we go and see the patients, we saw that sometimes on weekdays, the kids will never be home, only the patient. So the kids, we need to ask the kids question.
That's really where the telemedicine comes in now.
That's where telemedicine is so perfect. I mean, it's such a great... I have heard of telemedicine from the very beginning when it was being put together. And I went with my manager to several meetings, and I look at the thing and say, this is not ready. It's not just getting in front of a camera and talking to a patient. And I remember I was telling Dr. Shen, one of the inventions that I wanted to put was a jacket where I can listen to the lung and look at the heart and listen to the heart. And when I saw that, I said, wow, this is great. This is telemedicine. Because it's not getting in front of a camera and talking to a physician. Yes, that will be the beginning of telemedicine. This is now much more advanced. And I'm sure with Dr. Shen inventions and moving forward, I think, to partner with him would be great, because this is what we need to do. Go back to the drawing board, what is working, what can be improved, and keep improving things.
Dr. Shen, so you are a practicing cardiologist. So if someone wanted to also go to you, I can give them your phone number also. May I do that?
Absolutely, yes.
All right. He is located in Sunrise, and the phone number there is 838-1066. Again, 954-838-1065. And they don't have to wait months to come see you, right?
That's
Dr.
right.
Mencia?
Yeah, they can do it. They can just go on live.
Right? Just go in and find you. Let's talk a little bit about cardiology, because you're on such cutting-edge things. Is there anything cutting-edge in cardiology that you'd like to share?
Absolutely. So actually, the father of telemedicine, and who is a Dutch physician in 1906, about 110 years ago. He is the inventor of the electrocardiogram, and he is the first time and transfer the electrocardiogram, the EKGs people call, over the telephone line. And so that's marked the era of telemedicine. So telemedicine in cardiology had came a long way because a huge need, because heart attack is still a number one killer over 100 years worldwide as well as in the U.S. So when people have chest pains, a lot of times they not sure is this a real heart problem or not heart problem, but they don't have a device on site. And if this process delayed, going to the hospitals, and that can be life-threatening event. But on the other side, as Dr. Mencia talked about, if everybody have a little bit of chest pain, go to the hospital, then that were extremely costly for the hospital. So therefore, we need to provide some device for the patient, for the facility to find out if you do have problem, go to hospital. If you don't have problem, so therefore your physicians can take care of it. Maybe it's stomach-related acid reflux, maybe something else.
That's right. And ladies, if you can't connect your bra, don't call 911,
No,
please.
exactly.
But I want to put my gerontology hat on for a minute and tell us, everyone everything. We keep talking about the cost to hospitals. But let me just tell you something. As a former caregiver to an older woman, going to a hospital have a 911, all the commotion that has to get you to the hospital is very traumatic for an older adult.
It is.
So it's not just the costs. What is it doing to that older adult?
Well, and the complications. As a geriatrician, I tell you, a lot of the geriatric patients, when they get transferred suddenly from the environment to a different environment, they get very agitated. So even though they went in because they were having some chest pain, they could be reflux, or it could be just the joint on your chest wall that you have a little arthritis, and those joints can hurt just like your hand can hurt. So if a person take a deep breath and they get a horrible chest pain, they think their heart is, and they call the kids, "Oh my God, I'm having a heart attack," and they run to the hospital, and the doctor say, "Take a deep breath," and they take a deep breath. Ouch! I feel the pain. Okay, it's your chest wall. It's not your heart. Go back home. But the complication of those patients going there, they can get agitated. So now you have to sedate the patient. Now you sedated the patient. Now you have to admit the patient. But where are you going to admit the patient? Because the patient say chest pain, intensive care. Intensive care is very costly. Now they get more agitated, or they fall and break a hip. Now they have to have surgery. So it becomes a spiral of expenses, unnecessary expenses, that we need to learn how to avoid it. And with telemedicine, I think we're going to be able to do that. Now, that's only the tip of the iceberg. What about the urgent care centers? They are opening left and right. It's a multi-billion-dollar company. A lot of people say, well, I don't want to go to an emergency room because they might admit me, quote unquote. Let me go to an urgent care center. Urgent care makes a lot of money because they charge almost like a hospital, except that they cannot admit you. But, so the ideal thing is to go to your primary care doctor or to communicate with that person. And nowadays, what we have is only an operator to take the information. That information gets transmitted to your primary care, and you hope that the information from the patient to the doctor, because now you have one or two middle person transmitting the information, that what you are saying is what the doctor is hearing. So with telemedicine, you can bypass all of that and say, I'm going to talk to my doctor directly, and it's something that cannot wait for tomorrow, so I'd rather do it right away. And I think that will, open so many doors.
Well, Dr. Mencia, you know that we've been working on having a YouTube television show so that our conversation, because this is a natural, they could see.
I thought about that. Yeah,
Dr. Chang put this on me with the.
And they see the monitor.
That's right, to see the whole thing, because that's the problem. Radio is wonderful, and we do a good job because people have great imaginations. But for something like this, it is absolutely, someone has to see it.
Absolutely.
And because it's beautiful. He brought this tiny little case that looked like a little purse. He opens it up, and out comes this.
And this is exactly what the nurse will get when the nurse comes to the house, or what the patient will get. If you take this equipment, and you take this equipment, you go to Mexico on vacation, and you are in Mexico, and you say, do I want to go and see a Mexican doctor over there? They won't speak my language. Are they going to be able to have the equipment that I'm used to when I go and see my doctor? You said, let me put on my equipment and call my doctor. Exactly. And communicate with my doctor.
So this is going over the internet, you're saying?
It goes into the cloud, so we can pick it up from China when you are in Germany.
Cruise ships have to have this. Right. I mean, I can see so many things in the cruise ship industry with all the people. Thousands of people go on a cruise ship. Yeah. We've got to get you there to get somebody to buy that. But you're going to need a lot of them. So you should be very proud of yourself.
Oh, wow. Thank you. We're still in the infancy, as Dr. Mencia is saying. We start, at the very beginning, and I think this field is going to expand very quickly. And the future hold this is like communication. When you look at it 50 years ago, and we don't have phones, we have to go to phone booths to make phone calls. But the technology bring the availabilities of communication to the patient anytime, anytime, anywhere. So the telemedicine will do the same thing. So right now, when you look at the telemedicine, it's barely a branch of medicine. But in the future, I see medicine will be a branch of telemedicine because the patient majority of the time is at home. And we need to connect the patient at home, evaluate, provide availability of care. So this will go on above and beyond the hospital walls.
Well, it's been wonderful having you here, Dr. Shen. You did it again, Dr. Mencia.
Yes.
You always bring these. I always hold my breath.
Yeah.
Of course, I saw when you sent me his resume, which is 5 pounds of paper. You always find these great people. So thank you very much, everybody, for being here this morning. And we're going to have him at the Cure Symposium, aren't we?
Absolutely.
So we'll talk more about the Cure Symposium later on. But thank you for coming.
My honor is to come to work with you guys.
Great having you here.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.